Let's go now to the political reaction to Ford's request for input on vaccine mandates for healthcare workers. We're going to go to David Smith, the Progressive Conservative MPP for Peterborough-Kawartha. He is in Peterborough, Ontario. Marit Stiles is the Ontario NDP MPP for Davenport. She is in Toronto. And John Fraser, the Ontario Liberal MPP for Ottawa South, and he is in Ottawa. Okay, let's go to these questions, and I will start, David Smith, with you. Why now, after you see the Windsor Hospital having already not only put in a mandate, but actually started firing the unvaccinated? You have UHN, the largest health network in the entire province, the entire country, in fact, that's put in a vaccine mandate. Why are you dealing with this now as opposed to months ago?
As we were looking at this, we were seeing the vaccination rates increase significantly with people, and we've come to a point where it's started to plateau. We know that the way out of this pandemic is through vaccination. So we needed to see what was going to happen at the hospitals. And now Premier Ford has reached out to all of those hospital CEOs to see what the situation is at that hospital. I've said before, and I'll continue to say it, you can't make an informed decision if you don't have all the information. Now, Premier Ford is reaching out to get that information to make sure that we get it right. We can't be in a position where we're canceling surgeries, where we are not able to provide services for a patient when they come in because we don't have enough staff. So we need to see what those ramifications are.
Okay, but David Smith, the question is why now? Like, why wasn't this thought of months ago when we knew this was coming down the pipe? Why wait for hospitals themselves to put in a vaccine mandate, to start firing people, to start threatening to fire people, the largest hospitals in the entire province, before you start asking them what you should do?
We needed to have time to send the vaccinations out to people, to actually get the shots in people's arms. And that is what we have been doing. Now we're at a point where it has started to plateau. So we need to see what the effects are at those hospitals. It's the prudent approach to take.
Okay, Marit Stiles, I want to go to you. When you look next door in Quebec, they put in a vaccine mandate provincially and said, we're not going to budge on the date, we're not going to budge. And then they didn't see the vaccine rate come up. They worried about the very thing that the Ontario Premier is worrying about, losing enough staff to create something of a critical mess. Is it not then prudent what Premier Ford is doing, taking a cautious approach?
Well, I mean, you could call it cautious, I suppose, or you could say, like most Ontarians were today, what took you so long? Where was the Premier? I mean, I think Ontarians have shown that they're willing to take responsibility overwhelmingly, and they've been doing the work to keep their communities safe. The fact that the government today and the Premier came out with all these whataboutisms, basically saying, I have so many questions. We are in the fourth wave. It's mid-October. Where was the Premier all this time? And why was he waiting so long? And I think for a lot of us in here in Ontario, we look at what other provinces are doing, but we look to what our own leaders are doing. And what we heard today was a government that doesn't seem to have any solutions in a crisis still to this day. It's really, I think, unnerving because, in a pandemic, certainly one thing we've learned is that people want strong leadership. They've put the time in, they put the effort in, they want somebody who's going to have solutions. I mean, if the government is so worried about a crisis among healthcare workers, they could actually revoke Bill 124, which prevents healthcare workers from negotiating better pay or working conditions. There's a lot more they could be doing. And I think, again, what we heard today was the government just pushing this off to healthcare administrators at a time when Ontarians are demanding that our government actually step up to the plate.
Okay, John Fraser, let me go to you. The Liberal proposal is that you should have a mandate, but not for all healthcare workers, for frontline healthcare workers. Wouldn't having all staff face a mandate make hospitals safer?
I think that you have to make everyone who's on the front line, and includes people who are working with people on the front line. So, it's mostly people who are working remotely that would be not captured by, I have a private member's bill that we're going to be debating next Wednesday. Here's a really interesting thing. The Premier wrote a letter asking for what the hospitals asked him for last June. Hospitals just told him at the beginning of October, we want the same policy across the board in healthcare that you just did in long-term care. And now he's asking them what they want. So we put forward the bill because it's reasonable for families to expect that the person who's caring for a loved one in hospital or in home care or any other healthcare setting, that person's been vaccinated, or their teacher or their childcare worker working with their unvaccinated child that that person has been vaccinated. That's a perfectly reasonable expectation of families. And the Premier's delaying and dithering when, 4 to 5 families, they want this. And he's really essentially saying, like, well, I don't think that's a reasonable expectation, so I'm not going to help you with that. It's really hard to understand why the government has taken so long that Ontario's, so long to do something that Ontario's doctors, Ontario's nurses, and Ontario's hospitals have been asking him to do for months.
Okay, I want to talk to you also about something that's being done by the several hospitals under the UHN, the University Health Network umbrella in Toronto. And they have said not just that they're going to have a vaccine mandate for their employees, but also one for visitors too. There are some exemptions like labor and delivery. David Smith, do you think that that is something that should be applied province-wide?
I think that what we need to be doing is everything possible to make sure that we are reducing the opportunity for spread of this disease. And when a hospital is coming out with any kind of a policy like this, let's keep in mind that they are the experts in infectious diseases, in preventative measures. So if they're coming forward and saying this is what we should be doing right now, this is what they need to do in their hospital, then we should be respecting that. And we shouldn't be second guessing it and trying to override what a medical expert or what medical experts are actually saying.
Okay, there is one major, the largest hospital network, the one that by its own description has the sickest people in the province inside, that has made that a vaccination mandate policy for visitors with some exceptions. Do you think that that should be applied more widely and not just in those several hospitals?
I think that what we have is a number of different situations across all of Ontario, and we do have 140 hospital systems in Ontario. The situation in Ottawa could be very different than the situation in Timmins. It could be very different than the situation in Toronto, where UHN is. Mm-hmm. Here in Peterborough Regional Hospital or Peterborough Regional Health Centre has followed almost lockstep with what UHN has done. So I think that it's incumbent upon us to take a look at what those hospital executives are saying, because they understand the situation, the reality in their community better than we do across the entire province. And let's get those experts to give us the advice on what we should be doing.
Marit, Stiles, vaccination mandate for hospital visitors?
Look, today when the Premier was asked some of these questions, he gave this catalog of different reasons why he couldn't make decisions on a bunch of things. And I think at the end of the day, one thing we can all agree on is that our priority when it comes to our hospitals has to be prioritizing the most vulnerable patients. And so I think when leaders like University Health Network take a position like this, yes, the government should listen. And, MPP Smith there is saying, yes, you should listen to the experts and you should listen to each hospital. And oh, by the way, listen to other people. Look, this government has over and over again been told what needs to happen and have chosen to download decisions. They do not want to make a decision. They do not want to be held responsible for anything. And in this moment, it's so important that government is stepping up. And so, I think that while I totally agree that every hospital is going to have a say on this, as I know John pointed out, look, hospitals have been saying a lot of these things. They've been coming forward with plans and requests to the government, asking the government to step up and back them up, just like small businesses has been asking and school boards. And the government continues to download all of those decisions to the very, very localist level and not funding as well, I will say, adequately the actions that are required to keep everybody safe. So once again, the priority needs to be keeping those vulnerable patients safe. And I think hospitals are actually have written to the government quite clearly what their expectations are, and the government needs to show some leadership.
Okay, John Fraser, I go back to that original question with you and the idea of a vaccination mandate for hospital visitors.
Yes, I think it's a reasonable, very thoughtful thing to do. They've done it here in Ottawa. I think it should be a province-wide policy. These policies are not forever. This is to manage the pandemic that we're in right now. Now, the interesting thing about vaccine mandates, the Premier threw out a number of 15% of healthcare workers aren't vaccinated. But, and I know this happens in other hospitals, but the hospitals in Ottawa, CHEO, their vaccination rate is 99.3% for full-time staff, almost 98% for part-time. The Queensway Carleton Hospital, 98%. So, the evidence just doesn't bear out what the Premier's saying. Making sure that people are vaccinated going into any healthcare setting is important, not only protect the vulnerable people who are there from outbreak, and illness, but also to protect them from staff having to be off work because they test positive. No one's talking about the human resource risk that unvaccinated people pose or workers pose inside an organization. If you want to talk about not having staff when you need them, if 25 people are off because there's an outbreak or they've contracted that, that's serious. So I question the Premier's reasoning and numbers in saying, we've got to delay even further than we have right now.
All right, we will leave it there. Thanks.
Can I jump in on that comment?
You got like 10 seconds. 10 seconds, yeah.
It fully reinforces exactly what the Premier was saying today. We need to know what is happening at the hospital level and how this will affect their staffing if we were to do something.
If you don't know by now,
exactly
the evidence is there, David. The evidence
is clearly there.
Okay, we're going to leave it there. Thanks very much to the three of you, and have a good weekend.
You too. Thank you.
Thanks.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.